Hello everyone, welcome to Pharma Icon and the today's topic is adrenergic drugs. So first of all, what are adrenergic drugs? Adrenergic drugs are the class of medicines in which they are mostly affects the sympathetic nervous system. Okay, they are affect the sympathetic nervous system by which they are influencing the activity of the hormones like epinephrine and norepinephrine. These are the activity of adrenergic drugs. And what are epinephrine and norepinephrine? Norepinephrine is also called as a noradrenaline, whereas epinephrine is also called as an adrenaline. Okay, and how when we use the adrenergic drugs can be used to treat the variety of conditions, like they are mostly used to prevent such conditions like asthma, bronchitis, emphysema, allergic reactions, shock and hypertension, cardiac arrest like bradycardia, heart block. Okay, and orthostatic hypertension used as a nasal decongestion and urinary incontinence along with the fundus examination. These are the situations when we use the adrenergic drugs. And how they work: the adrenergic drugs are mostly work by mimic or interfere with the action of the sympathetic nervous system. Okay, they are mostly interferes with the activity of the SNS. And how the SNS responds: the SNS response may be fight or flight. Okay, and the adrenergic hormones are also called as a flight or fight hormones. They are increase the heart rate and increase the blood pressure and increase the BP, and they also decrease the activity of the digestion. And what are adrenergic drugs do? They are by influencing the release or acting of the hormones. Okay, what are the hormones? Like norepinephrine and epinephrine. And first only we discussed that norepinephrine is called as a noradrenaline, whereas epinephrine is called as an adrenaline. Okay, and how they work: they are mostly interact with the adrenaline receptors. What are the adrenaline receptors and how many types? Adrenaline receptors are the type of receptors mostly used to treat or prevention of the diseases. Okay, and how they are work? They are work by interfering with the types of receptors. How many types of receptors are there? There are mostly three types of adrenergic receptors. What are they? Alpha adrenergic receptors, alpha 2 adrenergic receptors, and beta adrenergic receptors. Okay, these are the categories of adrenergic drugs. First of all, what are the adrenergic drugs? The adrenergic drugs are mostly, first of all, categorized as a pressure agents and bronchodilators. Okay, pressure agents and bronchodilators. What are pressure agents? Pressure agents are nothing but substances that increases the blood pressure or they causes the vasoconstrictions. Okay, pressure agents increases the blood pressure, or vasoconstriction means they are constricted, vessels are constricted. Okay, and the definition, coming to the definition of pressure agents can be the substances or nerves or the reflexes that causes the blood pressure to rise. Okay, pressure means increases the pressure in the blood. Okay, and what are pressure nerves? Pressure nerves are the nerves that increases the BP when they are stimulated. Okay, they are stimulated, then only the nerves will be increased their pressure. And what are pressure reflex? Pressure reflex is a nerve reflex that constricts the arterioles, which are small blood vessels, to increase the blood pressure. Okay, arterioles are type of blood vessels, they increases the blood pressure. And how they increase the blood pressure? By vasoconstrictive action or the vasoconstrictor action. Two types of action the pressure agents may be works. What are the drugs categorized under the pressure agents are noradrenaline, norepinephrine, and ephedrine, dopamine, phenylephrine, and methoxamine and mephentermine. These are the drugs coming under the category of the pressure agents. And what are bronchodilators? Bronchodilators are the group of drugs. They are mostly helps the open airways by the relaxing of the muscles around them. Okay, open airways means bronchodilation. Here in the name itself they indicated that bronchioles are to be dilated. Okay, those are called bronchodilators. And how they work? They making breathing easier for the people with the asthmatic conditions or the lung infections. Okay, how many types of bronchodilators? They are mostly used to treat the beta 2 antagonist and anticholinergic and theophylline. These are the drugs coming under the bronchodilators. And how they work? Bronchodilators are a CNS stimulant drug, and they also act as a psychostimulant or uppers, a class of drugs that increases the alternates. Okay, their dilation. Next, they are mostly helps in the motivation, cognition, mood, and the physical changes. Okay, these are the activity of the bronchodilators. And what are the drugs coming under the bronchodilators? These are isoprenaline, salbutamol, albuterol, terbutaline, solmetrol, prometrol, and bambuterol. These are the drugs coming under the category of bronchodilators. Okay, and the next classification of adrenergic drugs are the CNS stimulants. What are the CNS stimulants? CNS stimulants increases the activity of the CNS system. Okay, they increases the alternates. What are the drugs coming under the CNS stimulants are the amphetamine, dexamphetamine, methylamphetamine, and mefantidine. So these are the drugs coming under the CNS stimulants. And what are the uterine relaxants? Uterine relaxants are nothing but the type of drugs act as a tocolytics. Okay, they are mostly decreases the uterine muscle activity. Okay, uterine relaxant, they relax the action of the uterus. Okay, they are used to stop the premature labor and give the fetus at the time to mature. Okay, these are called as a uterine relaxant. And some of the uterine relaxants like beta adrenergic agonist, calcium channel blockers, cyclooxygenase inhibitors, and oxytocin receptor antagonist along with magnesium sulfates. These are act as a uterine relaxants. What are the drugs coming under uterine relaxants? The uterine relaxants are the ritodrine, isoxapurin, salbutamol, and terbutaline. These are the drugs coming under the category of uterine relaxants. And what are the next category of drugs coming under the adrenergic drugs? These are mostly cardiac stimulants. So first of all, what is cardiac stimulant? Cardiac stimulants are nothing but the substances. They are mostly used to increase the heart activity and improve its function. Those are called as a cardiac stimulants. They are mostly stimulate the activity of the cardiac, means heart. Okay, heart functions are stimulated. Okay, and what are the drugs coming under the cardiac stimulants? Adrenaline, isoprenaline, and dobutamine. These are the drugs coming under the cardiac stimulants. Okay, and how they work? Cardiac stimulants are mostly increases the heart rate and increases the strength of heart contraction and increase the amount of blood pumped by the heart over the time. And these cardiac stimulants are also used as diuretics also. Okay, these are the important information about the cardiac stimulants. And what are anorectics? Anorectics are the type of medication in which they are mostly increases the fullness of the stomach during the meal or decreases the hunger levels during after the meal. Okay, levels of hunger after the meal, those are called as anorectics. What are the drugs coming under anorectics? They are amphetamine, fenfluramine, sibutramine, and dexfenfluramine. These are the drugs coming under the category of anorectics. They are act mainly on statistically center in the hypothalamus. Okay, these anorectics are acting on the hypothalamus to shows the procedure of anorexia. So this is about the anorectics. And these anorectics also affect the various metabolic activities like fat and carbohydrates metabolism, Along with these, anorectics are also used for the treatment of weight loss. Okay, and this is the cardiac stimulants and anorectics. And the last category of adrenergic drugs are mostly nasal decongestants. Okay, in starting only we will discuss about which situation we use the adrenergic. Like in that, nasal decongestion is also one of the situation we use the adrenergic drugs. Okay, what are the drugs coming under the nasal decongestants? They are xylometazoline, oxymetazoline, nafazoline, phenylephrine and phenylpropanolamine and pseudoephedrine. These are the drugs coming under the category of nasal decongestants. And how they work? The nasal decongestants are the drugs. They can help to relieve the sloughy or the blocked nose by the reducing swelling in the blood vessels and tissues of the nose. Okay, they reduces the blood. Okay, and these helps in the symptoms like cold, flu, fever, sinusitis and allergic conditions. Okay, these nasal decongestants are mostly used for the treatment of the cold, flu, cough and the sinusitis conditions. Okay, that's all for this session, and this is the complete information about the categories and classification of the adrenergic drugs. Thank you, and do subscribe Pharma icon.